Anthony, so happy to have you here today with
Thank you
us.
so much. Thank you so much. I'm glad to be here. Thank you.
Thank you. Let's get into you letting us know what you do in the health department exactly. What is your role?
Yeah, I actually have dual roles with the health department. One, I am the unit manager for the community engagement and outreach team with the health department, but I also serve as the project director for a health literacy project called Stronger2 that the health department won a federal grant, and I serve as project director of that.
Oh, that's wonderful.
Yes.
So can you tell us a little bit about what does the health department here in Fairfax County and the health literacy grant seek to achieve? What are some of the goals of this program?
Yeah, let me start first in terms of giving just a brief understanding of health literacy. Mm-hmm. One of the things that we saw as a result of COVID-19 and the impacts in particularly in communities of color and the African American, African immigrant, and our Hispanic communities, the rise in infections, the rise in, unfortunately, the mortality rates of the disease were a direct result of what we've known for years in communities of color, a lack of understanding how to navigate systems. So health literacy is an understanding of how to navigate medical systems, how to be in a place of empowerment, that you have a right to take control over your own health decisions. You have the opportunity and right to ask the appropriate questions, and understanding that the importance of that relates to the level of care that you may or may not receive in your current medical situation.
Wow, that's really interesting. So what you're saying is, if you don't speak English, you speak some other language, that it may be difficult when you go to your medical provider to explain to that person just what your health issues are?
Absolutely. And you also understanding, and some of this is generational in nature, mm-hmm. Not understanding that you have the right to question your doctor,
That's right.
to ask the extra questions, That's to right. insist on the answers that are comfortable for you.
That's right.
So it is a place of real empowerment that we're in the Stronger2 project. We're trying to educate individuals in community, but also educate medical providers on how to interact with communities. So it's really a two-pronged approach of one, empowering community through education and understanding of the importance of them understanding how to interact with their healthcare providers in their own personal medical situations, and what they have a right to have, the information, but also them understanding, just as importantly, that those medical providers should be providing them that information so they can make the best healthcare decisions for themselves. How do we do that? Is through education, through front-facing community partners, but also the second prong approach is also addressing educating medical providers. Those that literally for generations will maybe rush people through appointments because of healthcare standards or insurance standards. It's allowing healthcare providers to understand from a cultural lens, culturally and linguistically appropriate lens, that how they should interact with community in such a way that if we are working with someone as English as a second language, that we need to make sure that we're taking the appropriate time to ask the appropriate questions, that they really understand what they're trying to convey. And so asking those affirming questions with the patient is really important. So in the Stronger2 project, we're seeking to educate both community and the medical providers that are working with community.
That's a wonderful thing. And I don't know if we've had anything like that here in Fairfax County. So I think you're really tapping into empowering people, as you just said, working not only with adults, but also with youth in our community. And we're targeting people who are at risk.
Absolutely.
From the numbers, the African American community, the Latinx community. So thank you for that work.
Absolutely, and I appreciate that. I think that really the credit goes to our community partners that are part of the Stronger2 project.
Yes.
You know, it's a really a capacity building, front-facing approach with partners that have already been in community, that are already doing great work in community, many of which were on the front lines during in the beginning of the pandemic, and us bringing capacity through training and certification trainings and other supports, programmatic supports, financial supports, to allow them to not only do the work that they're doing, but to enhance that work with the built assets of understanding health literacy, and then in using their trusted voice in community to be able to communicate those effective messaging around the importance of health literacy to community.
That sounds just amazing, because people are being certified, they're being trained in these modules to go into these homes or whatever environment they are engaging with people, and to have something that they know they can offer, that they feel confident, that they can talk to people about issues. Because I'm sure when they get into these homes and engaging with people, you're going to find out that they have many issues. Housing issues, maybe food insecurities, and the like. So it sounds like this grant is really addressing those things that would really help community.
Absolutely, and many of those things that you just mentioned are social determinants of health, but they relate directly to the long-term health outcomes of the individual.
Right.
And there's research that actually says that it also relates to the long-term health outcomes of generational impact.
Wow,
so
this
is a generational, hopefully an attempt at improving healthcare over generations.
Thank you. We're winding down.
Yes.
We're getting the little flag there.
Okay.
So we could go on forever. But quickly, how can people get involved?
Well, before I get to that, just really quickly, because I think it's really important for folks to understand the dynamics of our wonderful team that we've put together. We have faith-based organizations. We have African-American fraternities and sororities that are doing wonderful work in community. We have medical providers. We have nonprofits. So it's a culmination of folks, and I just wanted to make sure that I gave the appropriate understanding of the magnitude of the folks that are behind this effort in community.
So it sounds like you've tapped in on the ground, groups that are already working in community, not trying to reinvent anything, because life is about relationships, and you want people who have built those relationships to work with those communities, to people to trust that they have their best interests at heart. So I thank you so much for coming today and sharing all of this information with us, and wish you the best of luck with this grant.
Thank you.
Thank you, Anthony.
Thank you so much. And if folks want to get further information, please have them contact the Fairfax County Health Department. I'm sure the information will be provided. We'd be glad to talk to individuals and organizations that may be interested in joining the grant.
Thank you so much,
Thank
Mr.
you so
Mingo.
much.
Thank you.
Thank you.